Welcome to another episode of In Your Business. I'm your host, Reeves Kurtner. Season 2 of In Your Business is presented by Moses Auto Mall of Huntington. Online at mosesmeansmore.com and powered by the Huntington Regional Chamber of Commerce and Kindred Communications. Today we're talking about a great program that's helping individuals in recovery find not just jobs, but career paths that can truly transform their lives and our region. Joining me is Ashley Payne, the Director of Marshall Health's CORE initiative, creating opportunities for recovery employment. CORE is working across our region to tackle the challenges of employment and recovery, partnering with local businesses, and creating new job opportunities through social enterprise development. We're going to dig into how they're doing it, why it matters, and the difference it's making for both individuals in recovery and our community. Let's get in your business. Let's start with what is CORE? What is the CORE initiative and its mission to help individuals in recovery and finding employment?
Thank you. First, I just want to say thank you for the opportunity to be here today. CORE is creating opportunities for recovery employment. We currently span 16 counties in West Virginia. Back in 2019 is when the program started. It was one of the first of its kind in the state in that it was a workforce initiative solely focused on individuals in recovery and assisting them in getting back into the workforce. So our goal and our mission is to just help people with barriers to employment, including individuals with substance use disorder, and getting back into the workforce and making sure they're workforce ready.
So 2009. Let me ask you that: who provides the funding for this program?
Sure. So back in 2019, this initiative was funded by the Appalachian Regional Commission and the Claude Bennett Foundation. Currently, we have several other funders, including the Appalachian Regional Commission, the Claude Bennett Foundation, and then we have funders and partners in Wood County, which includes Sisters of Health, Parkersburg Foundation, and the McDonough Foundation.
And then so now this is under the Marshall Health umbrella, right? What's their role in all this?
Sure. So Marshall Health plays an integral component in that CORE sits within the Division of Addiction Science within family medicine. And so within that, we provide wraparound supports for individuals with substance use disorder, all the way supporting them throughout the continuum of care, all the way from treatment and recovery, but also supporting them long-term in maintaining their recovery. And so employment sits in that piece of helping people reintegrate back into the community.
What's your background? How did you get involved in all this?
So I've been in workforce development a little over 12 years. Education is near and dear to my heart. I'm a third generation educator. And so seeing people go from not understanding, not having the skill set that they need to sort of re-enter the workforce was sort of my sweet spot. I fell into workforce development by working at Goodwill initially. And served there as an instructor and moved up in career development and helping folks get ready to broaden their career and expand it. And so I found that working with adults was what I really enjoyed. You could give them the tools and they could sort of put those tools into practice, and I didn't have to call mom and dad and say, hey, get them in line. So that was a really nice sweet spot.
How did you go from like the workforce development into the recovery side of things? How that? I'm just curious about your background.
Actually, that just happened by happenstance. An individual that I had worked with previously indicated that, hey, there's a job open. You might want to kind of take a look at it. And what really drew me to the position was really that it was helping people become workforce ready. I didn't have a significant knowledge about substance use disorder. However, my passion has always been about helping people get back on their feet.
That's right.
Reimagine who they could be. And so for me, it wasn't so much that I didn't have the substance use background. It was like, I know I have the skills, I have the ability to really work with people, and my passion is helping people reach their greatest success.
Hey, you know what the challenge is,
right?
And the goal is still the same,
right? Exactly.
So talk about what are some of the key challenges that those 16 counties that CORE serves faces in terms of employment and recovery, and then how does CORE address them?
Ooh, that's a loaded question.
That's a lot of. Let's break it down. Talk about those challenges when we're talking about substance abuse.
Yes. So as it relates to substance use disorder, the biggest challenges that we do see is that, number one, individuals who have substance use disorder do have a skill set. Sometimes people see they have that stigma of who people are, and so that's a challenge. In addition to transportation barriers, child care assistance, not even having documentation to gain employment, like your driver's license, your state ID, your social security card, your birth certificate, like all of those just basic things that you need to just begin employment. A lot of times those are the challenges that we see.
So how do you all address those? How do you address the birth certificate and the ID and the transportation? How do you do it?
Right. So we see ourselves as a facilitator of a lot of things. Our job as CORE is we work to help people get ready. And what we do is we work with community resource agencies all throughout the community to make those connectors. So we work significantly with partners to identify, hey, what do you bring to the table? Can you help us with transportation? We'll send a referral to you for this individual if you can coordinate transportation for them.
Sure. Is CORE working with people currently in recovery, or are they, past those initial, that 30, 60, 90, 9-month, 12-month program, whatever it might be? Where are they in their substance use disorder recovery journey when you're working with them?
That's an excellent question. So when we started this program, we were like, we have to determine a baseline of like, when do we start coordinating services? So we kept the baseline really low in that individuals just have to be 30 days within recovery. And that's because we want to meet people where they are. Okay. There are some folks that have to get employment because they have a family that's depending on them. So we don't want that to be a hindrance. So we will work with individuals who are in recovery from 30 days on to 5, 6, 7 years. Yeah. It just depends on what point they want to tap into our resources.
Do you all drug test, alcohol test?
So we currently do not, but we do work with our partners, our referral partners who refer individuals to us. A lot of individuals come to us from treatment facilities, and so we can be a partner with them and say, hey, how are their drug screens looking? Okay. And then, of course, our employment specialists are trying to kind of recognize what some of those symptoms are and when we need to address and have those conversations.
Yeah, sure. So talk about career. CORE emphasizes focus on career path, right, rather than just securing a job. Why is that important for a person, for a person that's in recovery?
Sure. Well, I think we can probably all think about a job that we just had it just to have it.
I got it.
And we hated it.
Yeah.
Right? So we try to focus on where is it the individual wants to be? What skill set do they have? Because a successful placement means that you enjoy what you're doing, you have the skill set, and you feel competent, and then the employer is also getting something out of it too. So a successful placement means the individual wants to be there, and when an individual desires to work in a specific environment, then they're more likely to show up for work, they're more likely to be productive, and they're more likely to retain employment long term.
Well, but you a minute ago you said, we'll work with 30 days, and we'll work with the person with where they at, and they need a job to support themselves, support their family. That might be, I need just a job. I got to work, right? Yep. And it might be a minimum wage or barely above type job. But are you still working with a person in that situation, and how does that process go?
Absolutely.
Yeah.
So, and that the person stays in the driver's seat. The employment specialists at CORE, we really sort of are the coaches to just help them get to where they want to be. So if they just want immediate employment, we will help them pursue that. But if they say, hey, I want to continue to still work with you and find that career employment, we will help them in doing that. We're going to meet them exactly where they are.
Yeah. Yeah. Going back to the question I had on the drug testing and the screening, if a person has a setback, what does CORE do?
Sure. So if an individual does have a setback, obviously we don't completely disengage. We allow that person, we link them back to supportive services for treatment and recovery. That's step one, making sure those supports are there. But the other thing is we don't turn people away. If folks have a reoccurrence, we say the door is still open when you get back on your feet and you're ready to pursue employment.
Good.
We're going to have those conversations. The door always remains open.
Good. Talk about steady employment, how it contributes to the success of people in recovery.
Sure. Yeah. Steady employment really helps people maintain long-term recovery, because think about what your life would look like without purpose, passion, and structure.
That's right.
I mean, without structure every day, a lot of us would be on a couch and we'd never get up. We'd never accomplish anything.
That's right.
Which really creates sort of this silo of being isolated. So work really creates this idea of community and connecting people back to community and having that structure in their lives where they start to feel more in control of their own lives versus life being in control of them.
Sure. Yeah, like you said, the purpose thing, right? And you're at work more than you are awake. You're at work more than you are at home awake, right?
Yes.
So, I mean, you know what I'm trying to say, right?
Yeah.
Because we sleep the 8 hours a night or whatever it is, and your work becomes, your work family and all that kind of stuff, right? The community that you're there too. And it talk about, where you work is important too, right? There's some places you don't want to send a person that's in recovery to. That's not going to be a good environment for them.
Right.
You're not going to send them to a smoke shop or a vape shop, right? I mean,
exactly.
I'm stereotyping,
and that's where a well and safe workplace is so important, because you and I both know if the culture isn't right, if there aren't policies and procedures in place to respond to these issues, people, we used to live in this culture of leave your problems at home, at home. That's not reality. You carry everything with you everywhere you go. So it's important that employers understand, hey, if I want to recruit and I want to retain a strong workforce, I have to make sure that my culture is well.
That's right.
Yeah.
Yeah. Talk about, so how's this process work? I'm in recovery. I completed a 30-day program, 60-day program, whatever it is. I'm ready to get back in the workforce. I can't drive. Just kind of walk me through that process of what you would do for someone in that circumstance.
Sure. So typically, 90% of our referrals come from treatment providers or other agencies within the community, but people can also self-refer to CORE. Once that happens, they will meet with an employment specialist who does a comprehensive intake assessment to really gauge, like, what is their skill set, what are they interested in, but we're also going to identify, like, what are the barriers to employment and what supports do they need. At that point, we'll create a job development plan. The individual is in charge of saying, hey, these are my strengths, these are the things that I need to work on, and these are the goals that I want to set forth to sort of achieve. And so that becomes sort of the framework that we use to guide us in providing supports and services. So at that point, we're going to provide coaching to get them workforce ready. We're going to provide resume assistance, online job application assistance. We're going to help them identify jobs within the community. And if they so desire, we'll advocate on their behalf directly to an employer.
Help them get recommendations?
Exactly. Yeah. So we will help them throughout the entire employment process, all the way up to the point in which they are onboarded, up to 90 days after they're employed.
Once I'm there for 90 days, then you will kind of step aside?
We do.
Okay.
We do. We would love to engage longer, but right now capacity is limited.
Yeah, yeah, sure. What about that stuff that you talked about with the IDs, the birth certificates, the transportation, childcare? Where do you all play in all that?
So that's where we link individuals with resources that we've connected within the community who can provide those. Yeah. So that helps us focus literally on getting the employment, and we outsource that piece to community partners who are able to provide that as well.
Can you give us any specifics about job training and placement assistance that CORE has done?
Yeah,
or does do, I should say.
Since 2019, we've placed over 700 individuals.
Wow.
In the community, in a varied number of just industry sectors, including manufacturing, hospitality, healthcare, administrative, and clerical. I mean, it really just depends on
what. Can you name any employers?
Oh gosh, well, I would be remiss to give too many employers, but we've worked with Cabell Huntington Hospital. Marshall Health, Coalfield Development.
There we go.
Is one of our strong supporters. Recovery Point. I mean, we could just go on and on with the list. Yeah.
Yeah. I did a podcast with Mountain Mindful, which is a part of Coalfield Development, and again, amazing things are happening down there. Yeah. And I know that's a part of their mission is putting people that substance use disorder people back to work. So
we've worked with the hotels downtown. I mean, we don't leave any organization out. If folks are willing to hire, we're willing to help.
What about educational placement? I mean, is there a role that CORE plays in getting them not just ready for a career job, but they they didn't complete their high school education, or maybe they completed high school but they have no secondary education.
Sure.
And this person, man, if he went and got a degree from a Mount West or whatever, he could really go somewhere with that.
Certainly. One of our strong partners is the Manufacturing Center, Marshall University Manufacturing Center. Like, they're one of our strong partners. We send referrals to them all the time for individuals for training. And then we make connections all throughout the community with, training programs, and we will assist those folks in sort of navigating what that process looks like. So absolutely, if the person identifies that they want to pursue training, or if they want to get a GED, we're going to make that referral in the community to sort of be that warm handoff.
So if let me ask you this, going back to the employer thing, you mentioned Cabell Huntington Hospital, you mentioned Marshall Health, Mountain Mindful I mentioned Mountain Mindful Coalfield Development. Are they reaching out to CORE? Hey, we need 5 people, or are you reaching out to them? How does that process?
It's both.
Okay.
It's a both and. Specifically with Coalfield, there are times that I had a previous relationship with an individual that works at Coalfield, and because of that, she'll text me anytime and say, "Hey, we have this position coming open." Or literally 2 days ago, I texted her and said, "Hey, do you have anything open? I'm looking for a placement for someone." And so those are the types of relationships that we really enjoy, where it's almost like we're both on speed dial for each other to support one another.
So you mentioned like 16 counties. That's basically the westernmost part of the state, right?
Right.
Like it's 16 counties over.
Yeah.
Parkersburg, is that about as far east as you go?
Yes, and as south as Princeton.
Yeah. Are the challenges different?
Oh,
in different
absolutely.
Parts talk about that.
I think one of the challenges that we see is, specifically here in Cabell County, there are lots of supports for individuals with substance use disorder, and our communities are more open to reintegrating them back into the community. The more south we go, we see that as a challenge within the workforce. Employers there's still a challenge in there dealing with that stigma, of how do we see folks in with substance use disorder, what skill sets do they have, and are they going to be a real asset to our community? So it really just depends on the community that you're in, and those are some of the challenges we do face. And we just try to work with employers to say, at the end of the day, this is still a person. And they have a skill set, and sometimes we have an image of a person in our mind that really is not the image of who they are. Yeah. And so, to sort of bridge that gap and provide employees with the education and training to sort of open that door.
Why do you think, Cabell is more open to reintegration? Oh,
wow. Well, we've been on the boots grounds level since the very, beginning, and we've sort of been the folks, for lack of better words, we've been the pioneers, so to speak, here in West Virginia, sort of nailing down, like, how do we integrate? How do we work together as a community to provide these supports to ensure that our communities are not just, that people aren't just overdosing. Like, this involves a community of health and wellness. Like, how do we ensure that? And so I think Cabell has really done a great job of sort of coordinating together and rowing together. And sometimes I think that's something that we're trying to expand and trying to facilitate that in other communities so that as a state, we can all row together.
Yeah. Is this program, 2019, you said the program started, was it based on any other programs across the country? Or have other programs looked at this and now started other cores across their states? Sure.
So there have been other programs in other communities throughout the nation that have taken a look at CORE. I've had folks reach out to me from as far as California. I've had programs in New York take a look at CORE. So I think, one of those things is that we just want to be a model. We don't say that we know it all. It's still a baby. It's still in its sort of incubation stage, and we're figuring it out along the way too. So we don't claim to know all the answers, but we do have a model that we feel like is working, and it's one that can be replicated throughout the nation or within the state of West Virginia. And so there have been programs that have taken bits and pieces of what we do, and they've implemented their own programs across the state and the nation.
What are some of the biggest challenges that you and CORE face?
Sure. As a program, I think our biggest challenge that we do face is just always identifying continued funding. We don't plan to just be that one and done, hey, we met the check box and this program is done. Like, we're here to stay. And so identifying that funding to sort of sustain the program long term is a challenge. I, like any employer, still have the same challenge, in finding great employees.
How many employees do you have? So
currently we have 4 employees, and I'm currently recruiting for another 3. And so I'm still facing the same challenge that every other employer is facing, is that how do I, recruit great skilled workers, and how do I keep those skilled workers?
Are there opportunities for people that have been through the program to work for you?
Absolutely. Of course, those positions are posted. They are a baseline of requirements that they need to meet. But there have been opportunities where individuals have come through CORE and they have been employment specialists with CORE as well.
So when I asked, is Cofield Development calling you, or you calling Cofield Development, how can some of those businesses get involved? How can they reach out? How can they be a part of your team?
Sure. So if there are businesses who would like to be involved, they can always email us at corewv@marshall.edu. That is a way that they can connect with us. And really at that point, an employment specialist can come on site. We can have those sort of conversations about what it is, what are your needs, how can we support you? And so we sort of create a partnership based on that. Our employment specialists reach out to employers throughout the community on a strategic level, monthly, just to build those relationships. But we welcome any employer who would like to connect with us. We don't push employers. We say, hey, we will connect with you. We will build a partnership on the level that you want to build it, and we'll start from there.
Do you do outreach? I've never heard of CORE, okay?
Sure.
And if I haven't, that means other people have not as well, too. So Are you doing outreach like that, trying to get more potential employers?
Yes. And we do that through our employment specialists. Yes. Another way that we do that is, working with our local chamber. We have had partnership with the West Virginia State Chamber of Commerce. I would encourage employers to really take a look at our employer toolkit that was created in partnership with the West Virginia State Chamber. You can find it on the website. It's a substance use employer toolkit, and it really guides employers through what are the policies and procedures they need to have in place, and how do they create recovery supportive workplaces. Sure. So I would say that is a great starting point for folks to connect with us, but we try to offer webinars and opportunities for trainings, and so there are opportunities to connect with us on a varied level.
Same question. Are you doing outreach with the recovery programs, the recovery centers, right?
Sure.
Do you think all of them know about you, or same thing? You still need to get you got 16 counties. It's a pretty big, big region.
And I have to be honest in saying, sure, I'm sure there are tons of recovery organizations that we haven't tapped into.
You're right.
So that's always something that we're working toward, is creating those partnerships. One of the things I think we do well is that we do reach out. A pillar of what we do is that referral engagement. So making sure we're identifying partners within the community, including treatment providers, going to them, having conversations about what we do. A lot of our employment specialists go on site to these organizations to make it easier for the individual. So we actually have on-site days where we visit these organizations and provide services.
How has the program changed since 2019? Ooh. Went through a pandemic is one. Yeah.
So that's an obvious one. At that time, we were providing services literally virtually.
Of course, and we all were, right?
And no one had done that before, right, with the workforce development program. And so that was a real change. Every year, annually, we look at our policies and procedures. One thing I love about CORE is that, hey, there's no one saying, we've always done it this way. If we recognize that something is not working, the team, we respond and we say, let's make the change. And so we're annually reviewing those policies and procedures. Since that time, we've really started to work within a case management system, which really helps us sort of better engage with our participants and provide those services more readily.
Any examples of things that didn't work or could have worked better that you made changes on?
Oh, absolutely. So our intake process initially was about 45 minutes to an hour. And we were like, wow, this is way too long.
What does that mean, intake process?
So that intake assessment itself, all of the questions that you would have to ask, where it was taking about 45 minutes to an hour. Now, that might sound like, well, that's not that bad. But you take someone who is already struggling or who has a limited attention span. 45 minutes to an hour is a long time to be dealing with some hard questions. So we really started to say, what do we really need to know?
Right.
What questions are necessary and what questions are not? And then we started to shorten that so that it was more comprehensive and we were really getting down to what we really needed as far as information.
What kind of questions do you ask?
Oh, gosh. So obviously we do basic demographic information, like where you live and all of that. But we ask questions about what's your previous work history. Were you terminated from a previous employer? What was the reason for the termination? We ask questions as far as, what sort of career field do you want to pursue? What interests you? We ask questions about, are there restrictions to your employment? Maybe you have a lifting restriction. Maybe you can, there are all kinds of things that you have to think about before you place someone. Is there a scheduling concern? Do you have children? Because if you have underage children, we're going to have to figure out, what is this schedule going to look like? Do you have the support if you need to take a midnight shift? Is there someone who can keep and watch your children?
Sure.
So we have to ask like those day-to-day questions of what does your life look like? What do you want it to look like? And how do we get you there?
So when you do that assessment, how do you determine this person will be good in the hospitality industry, the food service, medical field? How do you come up and go, hey, and then after you figure, answer that question, please.
So,
and I got to follow up.
So the employment specialist doesn't determine that. It is the individual who tells us what they want to do. So there are some people that say, I'll take anything. And then we say, okay, so you want to, we'll throw out a random job that we know that they don't want to do. And they're like, well, not quite that.
Yeah.
So then that's when we ask the question of what positions have you had in the past that you enjoyed? Which ones have you had that you hated?
You kind of guide them to that answer.
Exactly.
Right?
But we don't make that determination.
Yeah. Okay. Because my follow-up was going to be like, if you recommend something, they go, oh, God, that sounds awful. But you're saying that you're guiding them towards
We're just a coach.
That. This sounds like this might be a good fit for you.
Right.
What you think.
Right. And sometimes we'll throw out different positions to kind of get a feel of what they might be interested in. And they'll say, oh, no. Or yes, I'm interested in that.
Say that number again. That how many people have successfully?
Over 700.
Over 700. What does that number mean to you?
700 lives changed. 700 lives with access to supports. 700 lives who have the money to make decisions about their own lives. 700 lives who have skill sets that an employer recognizes would be valuable to their organization. So 700 lives changed. And that's generally what we say every time. It's 700 lives changed.
Obviously, you want to do another 700, and that was in 5 years, right? 2019 to 2024.
Right.
Obviously, next 5 years, you want to do another price, 700 or 1,000 more. What other goals do you have for CORE?
One of the things we really like to see is, one of the things we see as a challenge right now is folks don't necessarily have those life skills, like that critical thinking of thinking through what what I need to do to get ready for the day in preparation for work. So how to help people work through those components of life skills. I think that's one component that we really feel like needs to be added to the program. Some folks may say, how's that connected to employment?
No, I agree that it does.
But
I agree.
It's a definite connection between the two. And so that's where we see people really lacking, is not really having that skill set to critically think. Case in point, we've had people who've had 2 job offers at within the same time. One will be for X amount, and they'll take the one for the lesser amount because they're going to start next week, versus waiting and taking the one that's going to pay more, that has more benefits, that may be starting 2 weeks from now. So helping them critically think through long term. How is this going to look in your life, and is this going to really support you long term?
Well, but I'll go back to some of that stuff should be in our public school systems, right? Of balancing a checkbook and understanding taxes and mortgages and borrowing money, all that kind of stuff. There's a great program at in West Virginia. I think it's called. The program's called Get a Life, and I don't know if you're familiar with this.
No.
Okay, so this is they do some middle schools, and I volunteered at my wife teaches at Huntington Middle School, and I've helped. The kids will walk in, and they've got a piece of paper and a clipboard, and on this page, they're making a minimum wage. They're making a minimum wage. They're married, and they have to go out and they go around the room and they get an apartment or they buy a house. They get a car, and then they have to decide do they want health insurance, and then little surprises will pop up along the way. Tooth fell out. You got to go to the dentist. That's $500 and so forth and so on. Then they do that and they're like, holy cow, I'm in debt $1,100 a month. Okay. You flip it over. You went to school. You went to a career school.
Oh,
you went
wonderful.
to a university.
Right.
Whatever. And now you're making $50,000.
Right.
You're making $80,000 or whatever. And you do the same process again.
Right.
My favorite part is these kids are making minimum wage and they're buying Teslas and $500,000 homes. They're like, oh my gosh.
It's not that way.
Right. Then they flip over the paper, and like I said, they've gone to a career technology school. They've gone to a college. They're making $50,000, $80,000, $100,000 a year. And, oh, wow. Okay. Now I can afford that nice Ford and this, and I can afford health insurance, and I'm saving. I'm left over with $500 a month. Okay,
exactly.
So the point of that exercise is like, hey, emphasizing getting a secondary education, high school, doing one step more. But they're doing this with like 7th grade kids. I'm like, freaking do this with 9th, 10th, 11th, 12th
adults,
college kids. Exactly.
Just do it.
Right. Just that education, like you're just talking about that critical thinking, all that kind of stuff.
Yes.
I think we need to do a better job of that in our public schools.
Exactly, and it doesn't just happen by talking, like lecturing. People need to do these things like that.
The kids
practically.
Like, I'm broke. Yes,
right.
Yes.
We have to make the connection practically, not through a lecture format. We all learn better once we do. Once you do,
that's right.
You learn better.
That's right.
And so, yes, that lecture is important, but we also need to bridge practical application to kind of build those skills.
Sure.
So people can, not feel like so overwhelmed. Like, what do I do?
Yes.
Because you'll already have those practical skills in place.
Yes. What are the ways you see CORE expanding or evolving over the next couple of years?
There has been quite a bit of request for CORE to expand statewide. I think that's definitely on our radar of things that we do want to do. Obviously, funding is going to be key to that.
That's right.
But we want to just support our communities and being better, and just helping people gain access to opportunities throughout our state, throughout our region.
Yeah, you mentioned 700 lives changed. Any specific stories? Again, don't name names, but give me one or two of just like some really awesome, powerful stories.
Oh wow! So there's one individual that we recently worked with who had a skill set as it relates to auto body. And he had worked in that industry before. We knew of a partner in the community that was expanding their auto body shop. And so there was a partnership that was created there, and that individual gained employment there, making well over what we all make.
Okay.
And to see the pictures of the cars that like he's refurbished or painted, and it's like, wow, like to see an individual not have these opportunities and to go to doing something that they enjoy again.
Yeah, that's right.
And I think that's sometimes what we miss is that a lot of individuals had successful lives before.
That's right.
It wasn't that they just checked out of life. They had successful lives before. And so when you can get people close to what they were doing or doing that again, I mean, that just means so much. I have another individual, and I'll share about this individual. She had spent time in federal prison for fraud. And if anybody knows anything, it is very challenging to find employment once you have a fraudulent
that's right.
record.
Fraud, embezzlement, all that, yeah.
It is very difficult. And so she had worked in the medical field, and she really wanted to go back in the medical field. And I mean, 4 months, we scoured, we tried, we did all we could. And thankfully, at the end of it, we identified a position. CORE was able to make contact with the hiring manager and give that resume. She had a successful interview, and she gained emplacement. Like, No one would have ever thought that would have happened. She would have never thought that it happened, but it did. And it's not solely on Core's part. It's a partnership between us and the individual.
Yeah.
She showed up. She showed that she had the skills, but we also advocated on her behalf too.
Yeah. Do you worry about, kind of like sticking your neck out in the line for a person like that?
Yes.
And then it doesn't work out. Like in that, I don't want to be where like, hey, Core recommended this person and then they completely screwed up.
Right.
Don't ever work with Core. Does it happen? How do you deal with that?
Oh, so that's a challenge.
Nobody's perfect.
Nobody's perfect.
Right.
So we require that the individual demonstrate to us, obviously, that they're showing up for their appointments, that they're bringing in half of what they need to for the partnership to work. So that's key number one. We don't stick our neck out on the line for just anybody. You have to demonstrate that you're workforce ready, you're doing all the things that you need to do to get and maintain employment. The other piece of the flip side of that coin is we try to tell employers, listen, this isn't like a product that we're sending through a it's not a product, it's a human.
That's right.
So I can't guarantee that this person isn't going to make mistakes. We've done our best bet to verify that they're going to show up for work. But I want you to be aware that this is a human.
That's right.
And so I think when we start with that and not seeing people as something coming through a factory line and we shoot it out and it's perfect, we have a better opportunity to say, hey, this one didn't work. Let's try again.
Yeah.
Yeah.
How do you think, in your opinion, over the last 5 years of being involved in this program, how are the stigmas out there? Obviously, again, different parts of the state, different stigmas kind of sound like, but do you think that's changed over the last 5 years?
Oh yeah, I definitely see that has changed. I think what has played an instrumental role in that is COVID. I think during that time, there were so many open positions and it's like, oh, I better tap into a talent pool that I hadn't thought about before.
Yeah.
So I think that has kind of pushed us into that, but we're definitely seeing that those stigmas are changing. Employers and people in general they're seeing that, oh, my family member had that same issue.
Yeah.
But that made them no less important.
That's right.
No less, valuable to our community. And so as we continue to do our work as a community to educate folks, then we're able to reduce that stigma. So, yeah.
And we all know someone who's been affected,
absolutely.
Right? If you don't, you must live in a cave.
Yes.
And if you're an employer and you're going to shy away from someone with substance abuse disorder, you're not going to have anybody working for you. Right?
Yeah.
I mean, it's just,
yes.
Everybody, I've done this podcast. I think I've done, I don't know, we're getting close to 50 episodes of this podcast. And it comes up a lot of challenges with business owners finding people to work.
Right.
And if you're going to shy away from people who have had a problem, had a setback, again, that are human, and it's a real problem, that you're not going to have anybody working for you.
And there are millions of people who are actually working who currently have a substance use disorder.
Absolutely.
And so many people say, employers say, not at our workplace.
Bull
and
crap.
You would be surprised. And people think, oh, we're talking about like a hardcore recreational drug, not like alcohol.
Oh, a functioning alcoholic, right? I mean, I don't know if it's a stigma word, but no, functioning alcoholic, absolutely.
So, we tend to go to the extreme, and it's like, no, what about the individual who's struggling with alcohol?
Yeah.
It's still an addiction. They're still showing up to work,
100%.
but no less they're still struggling with an addiction.
That's right.
And so helping people see, oh, I hadn't thought of it that way. And, sometimes I say, well, you say not here, I wouldn't have that. I said, well, if I apply for a job, do you know that I'm a person that, do you know what, you don't know what you're getting anyway.
Absolutely.
So why not take a chance on someone that you do know, hey, they're coming from a program, they've been working this, they're vouching for them, that, hey, they're going to show up, they're demonstrating skills. You have more of a success having that than just blindly, recruiting and hiring someone anyway.
Yep. Ashley, that's all I got. This was a really cool conversation.
Thank you.
I keep saying this too, right? There's so many great things happening in our state right now. I do believe that. I'm really optimistic with what's happening here, and little stories like this, not little, but just stories like this, programs like this, taking lemons and making lemonade, right?
Absolutely.
With this problem is just helping our area out in so many ways. Anything else you want to add? Anything I missed? I
just encourage folks, whether you're a person with a barrier to employment or you're an employer, if you want to connect with us, please reach out to us at corewv@marshall.edu.
And that's our episode. Thanks for listening. If you enjoyed this podcast, please like, subscribe, share, and even leave us a 5-star review. Season 2 of In Your Business is presented by Moses Auto Mall of Huntington, MosesMeansMore.com, and powered by the Huntington Regional Chamber of Commerce and Kindred Communications.